Hi, I'm Dr. BOTOX from the Real Housewives of Dublin and presenter of the UK version of Botched 50 Plastic Surgery Shockers. Here are 5 secrets that Botox doctors know and no other people really know. Or maybe they do, but maybe not. I'm going to tell you. Will I tell you? Yes, I'm going to tell you. Okay, the first thing is there's a product called Xeomin, spelled Xeomin. And it's not cold chain. So unlike Allergan Botox that has to come in a frozen box and it comes freeze powder and then has to be diluted with saline, this product doesn't need to be in a cold chain. So if you're out traveling or doing, like for example, I don't do clinics really so much anymore. I will go and see high net worth individuals or ultra high net worth individuals, and sometimes it's handy to have that as a backup with me just in case we get delayed or there's some problem. It travels well, but you got to tell your patients and you can't charge as much. So that's the other thing, guys. Using numbing gel when you're getting Botox, stop being such a wussy. I am the biggest wuss ever, honestly, and I do my own Botox. You have to be in the mood because you're like, but you know, if I don't need it, nobody needs it. So the third thing is people getting numbing around their lips before they get their lips done is crazy. Back in the day, 12 years ago when I first started, I am a DDS as well. So I used to inject in here to numb the area. And it was really clever thinking because people wouldn't feel their upper lip getting injected. But the problem with this was that when I went to inject, I had the lip would it would plump up. So it would basically vasodilate and the product would cause it to plump up. So I would have no baseline for my aesthetic eye and I'd be kind of almost injecting blind because you don't know where you're at to start off with. How are you going to know where you end up? Look, some doctors have no aesthetic eye whatsoever, so like whatever, but this was tricky. Then Juvederm introduced Juvederm Ultra, which was Juvederm 2, Juvederm 3, Juvederm 4, and it had the actual lidocaine in the product, and Juvederm Smile, obviously. Juvederm 3 and Juvederm Smile, by the way, are the same thing. So buy the Juvederm 3, you get double the product for like only 20% extra. Anyway, that's a separate video. So basically the product then came Juvederm Ultra. And then for a while what we did, because then we realized you're still getting all the injections. So patients wanted to get numb. But then when they got numb with the dental injections, the dental blocks, and then that product, people were getting almost tachycardic because it was too much lidocaine. I was having a heart attack myself getting tachycardic. Again, the amount you learn. I have 27 different diplomas and everything and anything. I've been trained in Cannes, Monte Carlo, Paris, London, everywhere, and I've seen it all, I've done it all, but honestly it's what you learn when you're doing it over the years, tens of thousands. So that was really important. People ask about diluting Botox. All Botox is diluted. It comes freeze dried. It has to be diluted with bacteriostatic saline because that is the least painful for the patients. It's really important to use that. And again, it will be diluted. If it's over diluted, it can move around the area and give people a droopy eye and stuff. So I don't know any clinician that wants to over dilute. It's insane to me. And finally, I saw somebody who was following me and was using injections for Botox with a